Well, hello, good morning, and welcome to you. I hope this finds you reasonably well, perhaps in a frame of mind than we might have been a few weeks back. This is our latest Exeter Living Business Club. It's a timely reflection, we hope, on health and well-being in Exeter. We'll be speaking with Erin Harrison, Head of Sales and Services at Nuffield Health, Exeter Hospital, James Moore, Director of Exeter Travel Clinic, and Molly Edwards, Practice Manager at Inspired Dental Care. We'll have short discussions with each of them and then a panel session. Today, we'll be discussing what we have learned from this, insert your own adjective of choice there, year. What has changed in health and well-being for the companies in the sector, for businesses and their teams, and for the people in Exeter? We'll be exploring how they and their clients have been responding to these times, how offerings have been altered, what's better, obviously not what's worse, because that's a bit dull, and what they think of the year ahead. We're all now gearing up for this year coming, maybe the new financial year, maybe the sense, as mentioned, of optimism, the new beginning for us each. Please do send your questions and thoughts using the Q&A button below. You can ask your questions anonymously or be named as you like, perhaps add your company name to your question. And note that, as usual, today's Business Club is being recorded and will be on our Exeter Living YouTube channel later this afternoon. First up, a few parish notices of stuff we're doing as we also are gearing up for this reset. Our next Exeter Living Business Club is on new businesses on April 13th. It's a great opportunity to highlight interesting new ventures and to explore their thinking. Vital for us all to support new businesses, the lifeblood, often as not, of all of the cities, to hear what they're doing, how they've been faring. Please also look out for our Exeter Living Business Surgeries. These are bespoke, deep dive sessions showcasing companies' expertise through discussion rather than presentation. So it's an exploration. Multiple areas, from financial to legal, to the technology of hybrid workplaces, to marketing. Please talk to us about how you might be involved, because frankly, all of us can do with advice, and most of us can do with new business as well. A couple updates on our awards. We're absolutely thrilled to say, of course, that the Exeter Living Awards are back in real life. It's been a while, but they will be returning, as you can see, on the 2nd of September at the university's Great Hall. The awards were actually the last public events we as a Business Media Clash ran in 2020, so it will have an extra resonance for us, but we hope that absolutely applies across the city as well. The sense, the opportunity for everyone to come together, from the coolest of the indies to the largest of the corporates, after this year of all years, we think it'll be a high watermark for Exeter and would be a great opportunity to celebrate. Please note, of course, we're not expecting people to be talking in their nominations about it being a record year, because it simply won't have been a record year for virtually all of us. So the nominations very much allow for the effect of the pandemic. There's a specific question in that area, but that informs all the answers on the nomination form. So please do look for that. On sponsorship, if you're an ambitious company or one seeking to rebuild your business pipeline, or just plain proud to be a leading Exeter company, please do consider sponsoring. Because of this emotional heft, because of the interest in coming together, this year we think will actually be more powerful probably than any other year. Those nominations are open and it's free to enter via the website. And one other thing about nominating, a top tip for you, it's a great chance to foreground just how your team has responded in the pandemic. Our current roster of sponsors, and there's a couple of new ones here as well, feature Marsh Commercial, Exeter Science Park, great to see them coming on board, Powderham Castle, likewise a new sponsor for us, Regis, Warwick Event Services, Yellowtail Financial, who joined tail end of last year. Again, good to see them on board, good to see all on board, including Triangle Networks and of course Exeter Living. Beyond that, we have been seeking to launch, I think the expression is, the Exeter Property Awards for some time, and we are very proud to say that the inaugural awards will be happening in real life on November the 19th, a little bit later than planned, but you know why, and they'll be held at Sandy Park. It's a lunchtime and afternoon event. It's a great celebration of the property scene, but really the whole professional services scene, hundreds of attendees, and dare I say, many convivial business meetings. And they follow in the august footsteps of our similarly successful property awards in Bristol Bath and Cardiff. And yeah, sponsorships are available. Our current roster, it's a great group already for a new venture, headlined by Close Brothers, An Original Style, Vickery Holman, Wilmot Dixon, and feature sponsors Redrow Homes, Triangle, and Yorkshire Building Society. You can see the commitment and momentum, which is really good to see indeed. Excuse me. Separate to all of this, we're very mindful that of all the sectors hit by the pandemic, hospitality has been perhaps hit pretty much the hardest. We're running a virtual conference, it'll be free to join, the whole sector, called Crumbs Takeaway, as part of our award-winning Crumbs brand. Takeaway, of course, as in what you gain from conferences. A few details here. It'll feature national level keynotes, panel sessions, practical insights, and some truly heartwarming tales of the good that people do. Our hospitality businesses have responded, and they have responded magnificently to support others. If you're in hospitality, please do join. And if you supply the sector, want to show your support, raise your profile, rebuild those business channels, please let's talk. At the heart of all of this that we do in Exeter is Exeter Living. We're proud to publish our magazine that celebrates the very best of this incredible city, from arts to professional services, from hospitality to property, from business services to retail, from startups to long-standing businesses, and all in between, of course, including health and wellbeing companies. We're also really proud of the support we've had from the businesses of Exeter during these times. Thank you. It's truly great for us all to see that momentum building and confidence rising. Right, let's do this thing. That's enough of all of that. Let's bring forward our first speaker, and our first is Erin Harrison, Head of Sales and Services at Nuffield Health at Exeter Hospital. Erin, good morning to you. This is where we have the mild frisson technology where we all think, is it going to work? Probably me more than most thinking that right now. Erin, there we are. We see you.
Yeah, there we are.
Yeah. How are you this morning?
Greg.
How are you this morning?
I'm very well, thank you. Yep, very well here in sunny Exeter. It's absolutely beautiful outside.
Yeah, it sort of feels like summer already, doesn't it? It's a particularly great day today.
Yeah, it really is.
But you at Nuffield Health as a whole have had just the most tumultuous of years. Perhaps talk us through some of the key points of that and how you as a professional have sought to approach it.
Okay, so yeah, we've been, like most businesses, we've been greatly affected, obviously, by the coronavirus. Certainly, healthcare is obviously on the front line of the response to the pandemic. And actually, back along in April of last year, the independent sector agreed to support the NHS, and of course, Nuffield Health is a part of that. So that has meant different responses in different parts of the country, depending on what the local need was. For us in Exeter, that has meant supporting the RD&E, helping them with their what we call kind of urgent work, so patients who are waiting for operations that are life-saving or certainly life-changing, and who wouldn't have otherwise got their operations, because obviously the hospital in Exeter has been looking after coronavirus patients. So it has been really challenging, but my colleagues, myself, particularly my clinical colleagues, have been extremely proud to support the NHS in their response to the pandemic, and enable that urgent healthcare to continue in Exeter. And it's
can I just ask
humbling, to be honest. Yeah.
Thank you. Sorry, I think we've got a slight saliency time delay here, but I wanted to ask you about how it worked in practice between two organisations. You clearly have fundamentally the same aims. You have several of the people in common at the margin, I would imagine. But how about sort of cooperating in these times? Were there any complexities of that logistically?
Yeah, that's a good question. So yes, there were. So we obviously collaborate and work together on some level in sort of normal working times, but nothing like we have done over the last year, and that did require setting up new ways of working, new processes, at pace, obviously, to make sure that we were able to provide safe patient care, not just in terms of physical safety, but obviously things like data protection, the sharing of medical records and all that kind of stuff, making sure that we were compliant. You can imagine that healthcare is a highly regulated sector. So yeah, that has been a huge challenge, and certainly the teams that I look after are administrative, so they've all had to work in very different ways, but the teams have risen to the challenge and more, which has been fantastic.
Yeah, the resilience and adaptability is a theme across so many sectors, so many organisations, and I'm sure it's absolutely the case with Nuffield essentially right at the front line. But I wanted to come to your area of professional expertise of PR and marketing, to some helping, of course, shape the messages and so on. What messaging challenges have you had professionally this year?
So the focus has been quite different for us. So I guess it's been much more around storytelling and helping the local population understand the part that we've played and the part that we will continue to play. Particularly patients who are obviously private patients, they may be paying for their own treatment, they may be insured, and that's been really tough for them because they've paid for their operations, and they're having to wait like everybody else. So it's been trying to sort of explain that in a positive way, and in a reassuring way, which is something that Molly talked about when we were talking earlier, is helping patients to understand that we are doing everything that we can in a sort of safe way. For me personally, I've learned a huge amount because, as you say previously, my experience has been around sort of marketing, PR, building brands and businesses and that kind of thing. But my operational experience has been more limited. So yeah, this year I've learned much more about how to run a hospital, which has been brilliant.
Yeah, who knew the different skills that each of us or each of you are capable of? So that's quite the experience. And we'll talk more, of course, about the Nuffield and health and wellbeing a little bit later as part of the panel session. I just wanted to go to a tandem point that you're also the co-owner of the Tours Hotel in Dartmoor. That's quite the contrast. How, in brief, perhaps, how has that been for you?
Yeah, hospitals and hospitality. Who knew? Yeah, two sort of extreme, two sides of the coin, really. It's been a challenging year, I'm not going to lie. It has for everybody in hospitality, as you sort of talked about earlier. But for us, it was much more than a sort of business move. It was a move for our family as well. So I feel extremely fortunate to have been up on Dartmoor over the last year and to have had that on my front doorstep. Particularly working in a hospital during a pandemic, it's been an absolute blessing to be able to go home to Belston. Also, the business, there's a huge opportunity with the tours. It's a sort of unsung hero of Devon, really, and we're on an amazing journey there. So our outside kitchen will be opening in April, and that was something we launched back in the summer last year, and it worked extremely well for us. So I don't think we've been, to be honest, I don't think we've been affected as badly as some other businesses, particularly those in the city centre or those without outdoor space.
Well, please do consider joining us for the Crumbs Takeaway on April 19th. We'll be looking to hear the stories of how people have navigated. And today, obviously, is about health and wellbeing. And of course, Dartmoor as a great playground, right on the doorstep, as it were, as lockdown measures were released. So Dartmoor will be great for sort of physical health as well. So Erin, thanks for that. We'll come back to you in a moment, but if you pop off screen.
Pleasure.
Thank you. And we'll bring in James Moore, the director of Exeter Travel Clinic. James, good morning to you.
Good morning.
You sound very, you immediately look sort of positive and front-footed, which is welcome. Are you naturally a positive person?
Yeah, I think so. Relentless positivity, I think, is probably the mantra from the clinic, which is annoying to some, but I think you have to approach this in that kind of way.
Relentless positivity. Well, let's hope it's not too much for some at 10:15 on a
yeah.
morning. But to talk us through, the aims of the travel clinic. Of course, the clue is in the name. What do you seek to do, and what have you How have you modified that in these times?
So the aim, when I set the travel clinic up about 12 years ago now, the aim was for people to gain advice, travel health advice, vaccinations, anti-malarials for their trips overseas, and to get it from a centre that's dedicated for that purpose, with staff who are, have the best training that we can get, and to have the best up-to-date knowledge at their fingertips. So that it's really just a dedicated service to make sure that people travelling overseas stay fit and healthy and return with good memories and no bugs.
And of course, none of us could have expected, let alone wished, this pandemic. But as it happens, your service is pretty pertinent right now as people are re-emerging to think about travelling internationally and so on. How have you approached that? How have you approached the communication of that? You are this thoughtful company with so much experience in this area, such that can give people comfort about their own international travel plans.
So our message hasn't changed. Our message has always been, we're here to help protect you when you travel overseas. The issue that I think we've had is that travel has just been curtailed. And as of March last year, when we had the first lockdown, 95% of our business just vanished overnight, which put us in a very, very interesting position as we move forward. And then travel plans changed dramatically as we went through the year. People were not doing, and are still not doing, the long haul travel, the type of travel that requires more of our input. So we're talking about travel to perhaps Southeast Asia, Africa, South America, where vaccinations, malaria tablets are really quite important. Travel to European countries, we used to rarely see people who were traveling to Europe, because most travel in Europe, short-haul travel, you don't need any vaccinations or anti-malarials. And what you could get, you can get for free from your GP as part of the NHS treatment. So our clientele really has changed dramatically since long-haul travel has vanished, and continues not to be there. We are seeing very, very few people who are traveling outside of Europe at the moment for obvious reasons.
Yeah, I mean, I think you said losing 95% of your business was really quite interesting. I suspect most of us might have chosen another word. Maybe that's your relentless positivity. But how, from a business point of view, have you managed these 12 months with, perhaps barely 5% of previous trade? So
we stopped, we took a deep breath, we looked at what is not travel related. So we also do a number of occupational health things. The government grants were incredibly useful and helped us to, along with the furlough process, we managed to furlough our staff. And then as travel changed and adapted in the summer, PCR testing came in, and it became a requirement for anyone going overseas to undertake a PCR test. So we started, when the government had organised the guidelines appropriately, we started doing PCR testing. We weren't too quick on the mark with this, for good reason. We held back because I think a lot of people jumped on that bandwagon, and there are a lot of charlatans out there doing this too quickly. When it was safe to do so and the government were happy, then we started doing PCR testing, and that became the mainstay of our business probably until just before Christmas. And just before Christmas, it was incredible. You would have thought we weren't in a pandemic. The amount of people who were traveling, it was quite kind of crazy and worrying at the same time. The amount of people who were traveling overseas needing a PCR test was huge. And we did have one of our busiest autumns ever. It was busy, which is good. It wasn't the best busy we've had, in that it was a very different type of business, and it was incredibly stressful because of the timings, etc., that PCR tests need to be done and so on. So we adapted like that.
Could I just check, for those, frankly, also including me, who don't know what PCR is, what is PCR?
The PCR testing is one of the tests that we do to rule out somebody having coronavirus. So it's the swab up the nose and the throat. And there are a couple of different tests, and the PCR test is done in a lab. You have to send that away, and it's quite an accurate test. And the lateral flow test is the one that people are doing now in schools, etc. That's one you can do on the premises. And PCRs are really the gold standard that countries want when you're traveling there. So most countries have to have a test 72 hours before you leave the UK.
Yeah, I was going to ask you about this, that in your world, particularly long-haul travel, the idea of you have to have certain vaccinations, anti-malaria amongst the most prominent. For you, I would imagine the concept that you have to have this form of vaccination, coronavirus in this case, in order to enable you to do X, Y, Z, is pretty inevitable, normal, typical, whatever. But for some people, that sense of unless I'm vaccinated, I can't get something will be a real challenge to their personal civil liberties, they would argue. How would you address that point?
I think this coronavirus has really shaken society as to what they now understand as what is their right and what is their what they can and can't do. And we have approached travel for the last probably 80 years with a mindset that it's my right to go traveling overseas. And what we have forgotten is that it's actually a luxury that most of the world do not have. And it's a luxury that we can get on a plane and go to another country. Now, when it comes to travel, vaccination certificates are not new. So the yellow fever certificate has been around for 60, 80 years perhaps, enabling people. And if a country wants to stop you going there because you haven't got the right certificate, it's absolutely their right. And I don't have a problem with that. And people will need to get their head around this, because even if we don't bring in vaccination certificates in the UK and make it mandatory, which we won't, I think it'll be because we have a freedom in this country we can enjoy. Other countries are well within the rights to do that. And it might be that they say, unless you've had a COVID vaccination, you can't come in. And that's, you just have to live with that. And I completely understand and would agree with that wholeheartedly, like we do with the yellow fever. And if people don't want to abide by that, then they have to perhaps pick another country where that isn't a case.
Just taking away from the specific framing of travel, but as a more general point about this whole, there is a big debate about to emerge about no jab, no job, or no jab, can't go to concerts, or wherever it might be. Where do you stand on that point? Do you fundamentally apply the same thinking, even though that's not your professional area, or do you think it is different, that people should have the opportunity not to?
We have these rules already. So if you work in the NHS, if you don't have, for instance, a hepatitis B vaccination, you can't work in the NHS. And I don't have a problem with that. I think we do have to ask ourselves questions as a society about how much impact we have on other people around us, and what is our responsibility to care for others, particularly in the light of the fact that this vaccine is one of the most amazing vaccines that has ever been created and is incredibly effective and incredibly safe. So I don't have a problem with that. And organizations have already said, so for instance, Saga has already said, if you want to come on one of our cruises in future, you're going to have a vaccine. I don't have a problem with that. If you put 4,000 people at a high-risk category and slightly older category on board a ship and then introduce a coronavirus, it's going to be a recipe for disaster. So I don't necessarily have, where it becomes a little more difficult is in areas of hospitality. Can you go into a pub and buy a pint without having a coronavirus? I think that's a little bit more difficult, and I would certainly struggle with that issue. But I don't have a problem in certain areas with people saying, if you want to work here, we feel that the safety of our staff, the safety of our clientele require that you have a coronavirus vaccine. The president is already there, so I don't have a problem with that.
Yeah, there's liberty isn't infinite, I guess, that we all accept circumscriptions on our liberties, such as the traffic light system is probably the most banal of all, but we know that works, and so we accept that. So why we shouldn't accept it on a much more fundamental point is perhaps a little bit difficult to address. James, it is good to see you being so relentlessly positive. We'll come back to you in a moment as part of our panel, if you don't mind stepping away, sir.
I will. Yeah.
Back in a sec. Thank you. Let's have Molly Edwards of Inspired Dental Health join us for a conversation. Morning, Molly.
Hello, right.
Good. What's your tale of the lockdown been then? How has it been for Inspired? You've had, I'm guessing, a sort of quite a staccato time of off and on a bit and having to modify and then going forward and perhaps hold. And how's it been?
Yeah, so going back to 12 months ago now, I suppose, towards the end of March last year, we did actually have to close for a couple of months initially. I think this was during the more uncertain times. We didn't really know what was happening. No one was really sure what was safe and what wasn't. I think that was probably the scarier time for us, to be honest, more the uncertainty, really. So we ended up closing for a couple of months. We managed to reopen again in June. That was more so for emergencies. So any of our patients or patients that aren't registered with us, anyone who was in pain needed to see a dentist urgently, we felt that we had the resources, the knowledge at that point, and sort of the protocols and things in place for it to be safe enough to do that, and have stayed open since then, which has been good.
Which has been good. I mean, how have you attempted to reassure your patients, your clients, in advance that this is a safe environment and that they will be, you know, extra specially cared for?
To be honest, that has been difficult, and I think when nobody has the, you know, facts and procedures and the knowledge, because it's something new that's just come upon everyone, I think that's been a bit of a challenge. But you know, we've done all of our research, we've gone through the GDC, we've followed Public Health England, and we've made sure that, you know, the health and well-being of all of our staff and our patients has been our #1 priority. To be honest, the decontamination phases and things like that haven't changed much for us, because that's something you do anyway. And I think anyone working in healthcare will agree that, you know, those procedures are in place regardless. But there obviously have been some additional things that have had to be put in place, which I think when you explain that to patients and reassure, you know, we have everyone's health and well-being at heart, that's the main thing.
How has it been with you with other Exeter dental practices? Is it, you know, on the one hand, perhaps greater collaboration because you're all in the same boat essentially, alternatively, has there been a degree more competition because having suffered the loss of business, you want to get that new business? How's it worked?
Yeah, I think, you know, it's been really good getting advice from other places and talking to other practices and seeing how they're doing things, because a lot of the information that's been put out to everyone, I feel, has been a little bit of a grey area. You know, it's how you interpret things. You can advise to do something this way, but, you know, it depends how you take that yourself. So it's been interesting to get other people's sort of views on things and how they're following the guidelines as such. We have been really busy since reopening in June. We've been busier than we've ever been before. I can't speak on other practices. I'm not sure how they've been getting on, but yeah, for us, we have been incredibly busy.
And overall, is your financial year to the end of March, or is it calendar, or
end of March? Yeah.
March. I mean, very roughly, how has this year that's just closing, how's that compared with previous years, allowing for that, you know, interregnum at the beginning?
To be honest, it was massively affected at the start. And I think on behalf of a lot of companies, especially small independent businesses, it's been quite concerning. And I think at the beginning there was a lot of uncertainty. But as I said, the business has picked up massively, and, you know, we've seemed to recovered a little bit. So it has had a big impact, but we've tried to sort of recover as best we can, really.
And then conversely, are you almost sort of running at capacity, and you need to expand? Is that it's a nice problem to have?
Yeah. Yeah, so during the lockdown, we actually had to install another surgery at the practice. When they introduced fallow time following aerosol generating procedures to do with the air dropping in the surgeries, you have to allow time after each patient for the air to drop for it to be safe for someone else to enter. Which meant we were then working at half capacity because we couldn't reuse the same surgery. So for us to be able to still see as many patients we could in a safe enough way, we added an additional surgery to the practice, which meant, say, one clinician works in surgery A and then they see the next patient in surgery B, while A is being decontaminated and made safe.
Have you found, it's probably quite difficult to assess, but have you found that at least for some customers, do you call it patients?
Yeah.
Whichever they are, your people. Have you found that they have, on the whole, more focused on the more practical elements of healthcare and perhaps less on the, not cosmetic exactly, but you know what I mean? It's it's purely health. At least we can control that, even if we can't control, you know, what's happening on the bigger scale of the pandemic. Has there been
Yeah, that's exactly it. And I think, you know, we are quite a cosmetic practice, so we do offer a lot of additional cosmetic treatments, facial aesthetics, that sort of thing. But our focus has solely been the last few months on making sure that everyone is safe. And if anyone needs any urgent care or treatment, then we're making sure that we have the space and the sort of capacity to be able to accommodate for them. It has been difficult, obviously, with the fallow times and things, and there not being as much space for appointments as we had before. And to be honest, I don't know if that will change. Now they've done the research and they've got the facts. I personally can't see the fallow time being restricted, I guess, at all, really. I'm not sure.
Sorry, could you just explain for those who don't know the detail? Fallow time being, is that the amount of space you need per customer? How does fallow time work?
So fallow time, so aerosol generated procedures is anything that produces an aerosol. So if a dentist uses an ultrasonic or a drill, it produces more particles, and we have to allow time for those to drop. Even though we have all the protocols in place to check with patients before they come in, that they're not in, you know, with positive cases. But the fallow time is the time that we need to allow for the aerosols to drop to make the surgery safe.
So post each visit?
Post patient, yeah.
Post patient each time. And I mean, roughly speaking, how long is that?
We're allowing 30 minutes at our practice. Initially it was 60, which we were doing in between every patient. And you think in an average 8-hour day, that's a lot of time out of the day to have empty surgeries when you have patients that need to see you. And then it reduced to 30. I believe now the actual advised time is 15 minutes, but we're keeping to the 30 because we believe that that's how we want to continue for now.
Yeah, and that's a real juggle, of course, between the business side, which is frankly, the more patients, the faster the throughput, the better on the whole, and as mercantile as that, but that's essentially the core. Safety, reassurance, etc., which itself actually is a business benefit. If people think that you're taking a particularly thoughtful approach, also the most.
That's the thing. Yeah, I think the main thing for us is we want our patients to feel safe when they're coming here. Dentistry can be an anxious, you know, procedure for anyone anyway. So the last thing that we want to do is add anything to that. So the reassurance for our patients, making sure we're even over cautious, I don't know if that can even be a thing at this stage, is our main priority at the moment, for sure.
Yeah, for this existential experience that the world has had and individuals have had, I don't think overcaution does exist as a concept.
No, I don't think it does anymore at all, no.
Well, very good. We wish you and all our panelists and all watching, of course, the very best in these times. Let's bring back, if you hold it on screen, as it were, Molly, let's bring back Erin and James onto screen. There we are. Good on you. We've got that tiny delay on Erin, so I'm sure you'll be there shortly. There we go. I wondered, you know, clearly we have to talk about the complexities and difficulties of this year, but I wondered what have been the joys of this year for you for all this toughness? Don't all rush. Who'd like to take that?
I'm happy to go first.
Go, yeah.
So I think I alluded to it earlier, but I think the main kind of positive for us at Nuffield has been the ability to sort of directly support the healthcare system in Devon. And obviously we do that anyway, that's part of our, you know, that's what we do. But to be able to do that for people who are waiting for operations that they really, really need has been really humbling, and our clinical teams particularly have found that massively rewarding. So that's been the upside of the uncertainty and the, you know, sometimes it's been obviously quite scary for them working on the front line, but yes, it has been transformational to some degree, I would say. Yeah.
And James, I'm not going to keep tagging you with the relentlessly positive approach, because that's that'll be the last time I say it. But for you, what have been the extra sort of joys? Where have you found either sort of personal succor in these times, or you've seen it in others?
So on a number of areas, and yeah, believe it or not, we've had some really, really positive experiences during this time, and have come out of it quite strong. The first thing for me was that the team that I work with have been amazing. And it just goes to show how much, if you invest in your team when times are going well, you reap huge rewards when they're willing to support you when things, get slightly difficult. And so, and the team have really kind of risen to the challenge. We managed to get involved in the BRACE trial, which is the Exeter University and RD&E trial for the COVID BCG vaccine trial, which was really, really useful. And we were also able to apply our skills to helping a local school set up their lateral flow testing. So the kids now back in school, people listening might well have kids that are having lateral flow tests at school, and the schools were basically given a kit and said, right, set up your lateral flow testing, and which is really complicated for teachers and staff who've never done this before. We were able to get involved with a school to help support that, which is brilliant and made a massive difference to them. And then finally, it enables us to look at the systems that we have in place. And this is one of the huge benefits that this COVID pandemic has brought. It's enabled healthcare systems to look at how they work and how they function and how they can reduce clutter and become much more efficient and work better together in partnerships to deliver really good quality care without the complexity and bureaucracy that seems to swamp any form of healthcare nowadays.
Yeah, the need to get on and do has sort of trumped the desire for perfection, I guess, at the margin. That doesn't mean at all a diminution of quality, but it's the ability to act. How about for you, Molly? What have been the positives that you would look when you reflect on this year as it just is ending?
I think this similar to what James has said, to be honest. I mean, our team's been incredible, and I couldn't thank anyone that's worked here through this enough. Everyone has pulled together massively. It's made it more bearable, to be honest. We've put extra things in place that we're going to stick to now. We've had new additions to the team, so being able to offer employment at a time like this has been a really nice thing to be able to do. And I think all in all, when restrictions do start to ease a little bit, people will appreciate massively how simple life was before, to be honest.
Yeah, it's take the positives wherever they are, and some of the positives were always there. We just didn't realise.
Yeah, that's exactly it. I think,
Yeah, I'm sorry if that sounds like a bit of a Disney truth, but there is some truth in that. How about for you, either personally or professionally, all three of you? What have you learned from these times?
Look after your team. First and foremost, your team is your most important part of your business, and that's well researched in literature. You've got to make sure your team are in a right place and are well supported and cared for. And think outside the box, or completely think outside the house. You really need to think sideways in times like this and make decisions, and don't be afraid to take steps, and just do things and make things happen.
Yeah, I think that's. Couldn't agree more with what you said, James. I think that's spot on, to be honest. I think without our teams, we wouldn't all be here now, would we? So I think, they need massive appreciation and for sticking through this tough time. And, any sector working through this, whether you've been furloughed, whether you've been made redundant, whether you're still working or whether you're working double time, I think everyone's played their part in this sort of global pandemic. So, yeah.
That's I'm sure, Erin, that's likewise been a similar learning, but I wonder if there's additional points that you've now, again, as you reflect on that year, what you've learned personally or professionally.
Yeah, I think I would agree with all of those. I would say it's probably a given about looking after oneself, and obviously there's been a renewed focus on people's mental health as well, which Nuffield has certainly invested in at a central level as well as at a site level. So we have emotional wellbeing champions, of which I'm one for the hospital. We've got free counselling available. Some hospitals have been looking after patients who've unfortunately died from COVID, so they've had palliative care services. So it has been, there are lots of people across the organisation that have worked really, really differently clinically and the non-clinical teams. So I think, you know, you're absolutely right. There's so much positivity, but it's definitely had an impact on people's mental health. And I think also, you know, you've got people who've got dependents, they've got children, those people that have been homeschooling, fortunately didn't have to go through that one. We were able to send Jasmine to school, and really encouraging people to make sure that they're taking that time out to look after themselves, because if you don't do that, then you can't look after other people.
Yeah, there's almost been a sense that that everyone is everyone's therapist in these times. That many organisations, you know, say, yeah, at one level it might be the pubs and cafes are a natural place, which of course haven't really been able to trade and therefore exist in the same way. But have you found that your teams have effectively, not professionally, but effectively been acting as a sounding board, helping people through, supporting from a mental health point of view, even if your customers and clients may not see it, frame it in those terms, that people wish to talk about their thinking more deeply than previously?
I think from our point of view, I think going to the dentist nowadays is like a day out, really, isn't it? Because there's not much else people can do. So, you know, our admin team in particular, you know, have been really supportive. People want to talk about everything. There's a lot going on in the rest of the world as well, which people really want to discuss. And other than social media and online or, you know, over the phone, people want to have a face-to-face interaction and discussion about things. So I think they've sort of taken on a bit more of a new sociable role in that aspect, and our nurses and clinicians as well, really. So yeah, for sure, I think it's becoming a more sociable thing going to the dentist now.
Well, you know, maybe hold on the marketing campaign in Exeter Living for Inspired Dental Care, saying the new theme park, but there must be deep truth in that. That, you know, when our activities are limited and our need to talk, communicate, understand, whatever is rising, it must have something. All of you have something of that function, I guess, with all that you speak to. Can I come to that mental health point further? That possibly with the exception of the Nuffield, and you mentioned, Erin, a little bit about you know, some initiatives to come. But do you think that need to be supportive, thoughtful, etc., is something that will endure in your businesses, because people, as I was trying to indicate before, are much more open about their own complexities and issues than previously? Or not?
I certainly think so. For us, I think, I mean, it's a bit anecdotal, but I suppose the change that I've seen with colleagues, really, and myself, is almost that willingness to take that extra step of having that conversation or seeking that bit of support if you need it. Whereas perhaps pre-COVID, you might have brushed it to the side, or you might have, there were all these other things, to Molly's point, that you could do to make yourself feel better. But so much of that has gone, so much of those support networks, you can't see your friends, you can't go to the pub, you can't go, well, you can go for a walk, but that's about all you can do. So I think, yeah, I think people actually seeking help and doing something to take care of their mental health, I think there almost has been a barrier removed. Which I think is positive. I do think it's positive, because, you know, you can carry a lot around with you, can't you? And, you know, sometimes that's not always a good thing.
Yeah. Yeah, you know, in one respect, we've all become more human. The barriers have gone down in multiple ways, including the domestic settings in which you know, we're all in right now. We see each other differently. Further apart, yet closer still, is one of the observations. Do you think that, you know, on a sort of macro basis, and I'm talking more from a purely business rather than the iteration of what you do point of view, do you think that healthcare and well-being has fundamentally been changed by this, that there is so much more focus on it, that frankly there's more need and therefore opportunity from a business point of view? Your sector is going to be, it's paradoxical, but ever stronger precisely because of this experience. I'm sure you wouldn't want to, you know, promote it as that, but that is potentially one effect of these times. We are all that much more health conscious, or one hopes we will be. James, perhaps you might take this.
Yeah, I think you're right. I think we've all become very much more health conscious. We've all become very much more aware of how good it is to get outdoors and how beneficial it is to leave our mobile phones alone. And I mean, we've always encouraged this at work, and I've been very keen to, for years now, I've taken my emails off my mobile phone, so I don't have those, so I can only deal with them when they're when I'm by my computer. And we have a rule in the house where mobile phones stay downstairs at night, and we have one of those old-fashioned things called an alarm clock if we need to wake up in the morning. And so we're not tempted to the last thing you read at night is your mobile phone and the first thing you pick up. And we try and break these cycles. And I think people have become aware of this. And I remember the first lockdown when everyone was out walking, and it was like there'd been a revelation, certainly around Exeter, where I live just outside Exeter. People think this is amazing. We've got this on our doorstep, and we've missed, families were out walking, and we've suddenly realised the importance of this. Now, when it comes to travel and my business, I think people have recognised a couple of things, some good and some bad. I think they've recognised that how important travel is, but they've also recognised, like I said before, that it is a luxury, and we need to the whole travel industry needs to have a massive rethink about how we do things, but not just for the benefit of ourselves in the UK, but for the benefit of the countries that we go to as guests and how we spend our money overseas. So I think there are huge benefits for us having this kind of natural reset as to the benefits of being outdoors, enjoying the outdoor life, and perhaps getting away from these screens.
And here we are
on a screen
talking to each other. And by the way, when you said it's something like it's a relief to be away from your mobile, one of your mobiles binged at that exact point.
Yeah, not mine, it's off.
Yeah, it was something. It wasn't mine. It was. But back to that purely business point, of course, the outdoors, the communality, the physical exercise, and so on. But from a sector point of view, if you were looking at this as a growth area, surely healthcare must be in a great place. With one extra reason, the amount spent on healthcare in the UK is actually lower than in many other leading European countries. And that there needs to be a sort of settlement at a much more macro level for investment in healthcare. Do you buy that point?
Yeah, we do. We tend to spend money in this country on ill health rather than healthcare. So we have an NHS kind of a national sickness kind of service rather than a national wellness, and we need to perhaps think a little bit about diverting that money away to the preventative side and encouraging people to get out and do more things to help alleviate the burden on places like the Nuffield and the RD&E, because it's much better to prevent these things. So yes, I think our business model needs to change massively in the way that we approach particularly mental health and improving health and well-being in the first step. And I'm sure Erin would agree with that from a Nuffield perspective, and Molly as well.
Yeah. So, Erin, let's take that point, but a specific one to you as well, to Nuffield as well. The sort of the settlement between the independent sector and the NHS. Do you think that's going to be, it will endure that sort of resetting it's been, or will it become more typical of what it's been in the prior, 5-10 years or whatever?
Yeah, I think that's a good question. So I completely agree with those sort of previous points, but I think that there is obviously the elephant in the room, which is that we do have a significantly aging population, not just in the UK but across the world, and there will be a burden that comes with that over the next 20-50 years before the population starts to decline. Sorry, you said we were going to end on a positive note, didn't you?
We'll get there, don't worry.
So yeah, I think regardless of whether we it is going to be a stable sector and a strong sector, certainly in the private arena. I mean historically the independent sector have always undertaken sort of 25% to 30% of the NHS workload anyway. So I think they would struggle if we didn't do that, and we would struggle if we didn't do that. Obviously that varies regionally. I do agree that there needs to be a bit of a shift though, and I think the other thing that I feel quite passionate about is that people, the general public, know that there is a choice, because you know, people are waiting a really, really long time, and some people are getting quite poorly. So where someone does decide to pay, that obviously picks up sets a waiting place free over in the NHS. And it seems in the UK, as you say, we spend money on kind of sickness, but we're quite happy to insure our pets, and, you know, spend money at the vets, and you know, Molly, we spend money on our teeth and so on, but that hasn't quite translated into the sort of more general healthcare. And the reason that I feel quite passionate about that is just from sort of personal experience, you know, as family members and things have been poorly in the past, and it wasn't something that I knew very much about before I got into the sector. Plus, I should also say the Nuffield is a registered charity, so unlike some of the others, we don't have shareholders, which means all of our money goes back into the group. So ethically, I sort of buy into what we do, and that's important for me.
Yeah, I suspect that's fair and appropriate to make that distinction, and it does matter. It sounds to me as just hearing that part of the conversation that if anything, that of course the sector as a whole is increasing naturally in importance, and that will endure. But if anything, the key area is health education and preventative work of all different forms, rather than necessarily the responsive work, as perhaps as James has referred to. Okay, let's come on to, and I want to keep this on framing it as a business discussion. I know that seems a little bit antithetical when we're talking about people's health, but you in different ways are commercial entities, albeit structured, of course, in Nuffield's case, as a charity. But you need the input, you need money through, and you know, some costs out, and the result is happiness. How have you been seeking to provide or find new business, new clients in these times? What are your routes to market?
Who's going first?
I don't want to interrupt anyone, James. You go.
Oh, you're also lovely and polite. I'm actually going to say, Molly, you go first. How about that?
Okay, so obviously we spoke before about screen time and things and marketing, sort of that way. I think people at the moment are probably spending more time than usual on the internet and having a look online, and you know, as we've all touched on briefly, I think people are getting more educated now and looking after themselves and healthcare and things. So I think from our perspective, and as Erin said, you know, paying for healthcare can reduce the wait time, and we've had a lot of new patients join us from the NHS that haven't been able to see a dentist for months and months, or are overdue, and you think, you know, prevention is key, and that's sort of been how we've continued to grow. I think is we have had a lot of new patients who have been waiting a while to be seen, or you know, have moved house and haven't registered, and having the time, you know, to research. And healthcare is being sort of shown everywhere at the moment, hasn't it? So I think that education has sort of maybe moved people slightly over from NHS dentistry, and that's probably helped us quite a lot for sure.
James, your thoughts?
We've been probably more reactive because of the given circumstances. So it's pointless us kind of looking for new business in terms of vaccinations and travel when you're not allowed to vaccinate or you're not allowed to travel because the market's just been taken away. We moved into PCR testing, which has been brilliant, and we're currently looking at lateral flow, so instant testing, which is another market, which is another form of income for us, which is good. It's not really the type of income that we want though, because it's fulfilling a testing process and it's not playing to our skills. Our occupational health work has increased, which is good. So supporting people like Molly and the dental clinic, providing occupational health support for their staff. We've increased, there was a huge flu push this year, flu vaccine push, and we got involved in doing a lot more flu vaccinations. So that was quite good. And I can see that happening again. Interestingly, the flu season was probably one of the smallest we've ever had because everyone's washing their hands and wearing masks, which it was a situation that was mirrored around the world. So we didn't see as much flu this year. So that was another area. And then we'll just see how things pan out in the summer. We'll continue going, but we're very much waiting to see what happens with international travel, and then we'll respond accordingly. And it'll probably be tied in with going back to what you originally said about vaccine passports. will be involved in that.
And Erin, how have you approached this about, of course, seeking business out there? But I know you've explained about the different relationship, at least sort of for the time being, with the NHS. But in terms of generating business, marketing or services and so on, how's that been?
Yeah, so we really had a pause on marketing and not really PR, but certainly marketing over the last year, because we couldn't really accommodate many private patients. But we're essentially going back to 100% private from the beginning of April. So we're starting our advertising budgets and things back up again. Paul will be pleased to hear. Starting, we don't have huge budgets anyway, but yeah, we'll be starting to get back to a bit more sort of BAU. And kind of getting our name and our brand out there. And it's really for us just making sure that people know that we're open. So yeah, I suppose I should say we are anticipating that we'll start to see a different type of patient, which is, I guess, maybe what Molly mentioned as well, that we'll see people who previously have stuck with the NHS for a lot longer. But obviously as the wait times go up, we're similar sort of case really, that they'll perhaps consider coming privately.
Yeah, I mean, everyone there's been much talk about this, the diagnosing the problem which is down the line. There's been so much healthcare which has been delayed, but it is going to have to be addressed, and that therefore will create a squeeze from which, again, this sounds a bit businessy, but from which you and others, of course, will benefit. There's a greater need in 22 of work which has not been able to be done in the last, or late 21 and early 22, not been able to be done in the last 12 months. Okay,
yeah.
As we come to a close, I'd just like you to just reflect about how you see this coming year. You've each touched on this, but talk about it from a professional point of view, perhaps personally, but really for Exeter and the wider area. How are you seeing this year now from where we are at this point?
Okay, so I think from our perspective, we're through, touch wood, the worst of it now. We all have a lot more knowledge on what's been going on. We all have our protocols and policies in place, and it's more routine, I think, for everyone now. So, you know, as we see things start to ease and the restrictions start to drop and things like that, I think, you know, from our perspective, not rushing into just, you know, oh, we don't have to wear masks, we don't have to do this anymore. That doesn't mean that we shouldn't, and we should just completely go back. So I think from our perspective, just sort of easing through the stages, just being sensible and just being extra cautious. And yeah, I think, you know, on the 21st of June, maybe the streets of Exeter might be going a bit wild. So just trying to be a little bit cautious in that aspect, I think.
Well, let me ask you directly, what will you be doing on the 21st of June? Going a bit wild or being a bit cautious?
Well, it depends, doesn't it? Because we don't know for sure.
Okay.
I think it'll be hard to say that no one will have any. I think it's hard to say that you won't have any plans in June anyway.
All right, I'm not allowing you to do that one. At the point, which may be called June 21st, at the point at which you're allowed to do pretty much anything, will you personally be out there sort of celebrating and being hyper social?
To be honest, I think I definitely will be being sociable, but I think it's all sort of in our minds subconsciously now of being a bit nervous about being in big groups of people and going into a bar or a restaurant that's full of people near you. I think subconsciously everyone's going to feel a bit cautious. So, I mean, for myself anyway, I think, you know, you think about festivals or events going on, I think personally it's going to take me a while to feel confident to be in those situations, from my perspective anyway.
Unless, as we were talking earlier with James about, unless there's some sort of program which means there's on the larger scale activities, there's some sort of you know, proof of vaccination or whatever else.
Yeah, exactly. That will really put people at ease, I think.
Yeah, just that there has to be in travel for all the obvious reasons. How about, thank you, Molly. How about Erin or James? How are you seeing this year ahead, given that we are now in a very different place than we were even 6-8 weeks ago?
Shall I go first, and then James can end on a super positive note?
No pressure, James. No pressure.
Yeah, I think this year's going to be really busy, for sure, which we're really looking forward to. So yeah, we're really excited about getting back to some sort of BAU. I'm really looking forward to opening our pub. On a sort of personal note, it'll be great to see some customers again. It feels like it's been a really long time. Same as Molly, I'm not going to be rushing out and doing any, taking part in any sort of large events. I'm desperate to go on holiday, absolutely desperate to go on holiday. So I'll be around to see James, and hopefully we'll be going somewhere by the end of the year, or maybe it'll be the beginning of next year, who knows. But yeah, in the meantime, I should be buying a tent. That's my plans for the year. I'll be buying a tent and going camping.
Very nice indeed. James, are you a tent man, or you're intent on some other things?
No, I'm very much a tent man. I spend a lot of time on expedition overseas, so I'm quite happy in a hammock or a tent. I mean, we live in the most beautiful county in the country, and we're just about to come out of one of the most difficult times. It's going to be I'm incredibly optimistic about this summer. It's going to be, business aside, it's going to be hopefully a really lovely time for us all. A lot of people are going to be very relieved to be outside. I know the kids are going to be great to get them kind of back outside, meeting with their friends again. And I think from moving forward from a business point of view, we've all learned huge amounts through this pandemic. We have to be cautious. I think we would be naive if we weren't cautious, and we need to recognise that this is an international pandemic. And whilst we can get stuff sorted in this country, we now know that so much of it is dependent on how we relate to our friends and relatives overseas, and those of us who we share this planet with, and that we only need to have one little problem somewhere else and it can affect us and put us back. So I'm hugely optimistic about having a wonderful summer, and I'm doing so with an increased level of knowledge and awareness of this kind of little bug we've had to deal with, and how we can prevent it causing problems in the future. So yeah, onwards.
James, I think there's something like 6 billion people on the planet, and I don't think anyone else has ever called coronavirus a little bug. I appreciate your framing nonetheless. I couldn't possibly disagree with you on that point. Thank you to all of our speakers today, to Erin Harrison, Head of Sales and Services at Nuffield Health, Exeter Hospital, James Moore, Director of Exeter Travel Clinic, and Molly Edwards, Practice Manager at Inspired Dental Care. Thank you very much indeed for your candour, wisdom and insights. Thanks to everyone for watching this as well today. And of course for your continuing support, which we obviously really do appreciate for Exeter Living, as this weirdest of years, this 12 months at least, ends. And thankfully when this new world emerges, it is a time in one form or another of renewal. And that's something that each of you have brought out, that sense of maybe tempered optimism, but optimism nonetheless. That on the one hand, we have learned from this. 2, we've experienced stuff together and realized the strength and wonderfulness of our teams, colleagues, clients, customers, and so on. But 3, we can all start moving forward more positively, both personally and professionally. That hunkering down is just not an option. We've all just got to get out there in some way, in some sort of fairly careful way, I'm sure, because ultimately the future is unwritten, and between us all, we're going to be writing that future. Good luck to you, good luck to all watching, and in the coming months particularly. This has been a Media Clash production, and this has been the Exeter Living Business Club. Exeter together, always. Thank you.